I'm Katie Dunning, and we're going to talk about blebs. Meanest, worst, most terrible, painful, problematic breast problem I think you can have. And frequently leads to mastitis, which is like the second most problematic one you can have. So what is a bleb? A bleb is a blister on the tip of your nipple that blocks one of the milk pores. So milk is then trapped in that duct from that gland or glands, and it can't escape. So the pressure will build, and you can get more and more inflammation, and it can block more and more of your breast. You may first notice a lump further up your breast, or you may notice a sharp pain during nursing, and when you look at your nipple, you'll see a very circular white dot. Kind of looks like a white head, like a pimple, but it's a milk blister. So most moms, the first thing you have to do is soften that skin. It's usually only one cell layer covering over that nipple pore where milk should come out. If you take coconut oil or olive oil, put it on a cotton ball, put it on your nipple, then put a breast pad and then your bra, and then you can put some nice moist warm heat on there to soften that skin. Give it a good 20-30 minutes, and then you can take it off and either nurse the baby, or you can try some pumping or hand expression. If you're going to be using hand expression, you're going to start right at the base. Even if you have a clog further up your breast, if you start at the base of your nipple and work up towards the lump, and you can apply pressure above the lump with one hand while you're hand expressing with the other. And a lot of times the clog isn't where the lump is in your breast, it's further down your breast towards your nipple. So if you start at the base of the nipple and hand express working up, or pumping with your other hand, massaging and compressing and using warm packs while you're pumping, and then you can use cold packs for 20 minutes every 2 hours in between. If that doesn't do it, you can try opening the bleb with a sterilized needle, kind of like you open a sliver. Or some moms, just with enough pressure with hand expressing or the baby nursing, it will open it. You try that. A lot of moms, after having a bleb, find that they have to express a drop of milk to make sure that that area is still patent and milk is flowing after each feed, especially while you're awake. Middle of the night, that might not be very practical. But expressing a drop and making sure that it heals open instead of trying to heal closed again. It's really helpful. Some of the causes from that can be missing a feed, or the baby pulling shallow, or if the baby's teething and they're kind of grinding their gums or pulling back a little bit, that can cause a bleb, because it's a friction blister like you get on the back of your heel with new shoes. And breaking that cycle. If the baby looks at you and starts to pull back, take them off. Don't freak out or say anything, just set them down, turn your back, don't look at them for about 3 minutes. If you put them back to the breast and they do the same thing again, then I would take them off for that feed and maybe try something else if it's teething to soothe that itch, or maybe wait a bit. Maybe they're not really hungry. Maybe they just wanted to comfort nurse, which is fine if they're not hurting you. If the comfort nursing is hurting you, then they can comfort with another object. They can suck on their fingers, a pacifier, a teething ring, something. But finding out why they did it. So once you relieve, or once you get the milk flowing with that bleb, it's important to remove all of the milk you can behind it, either by nursing, and you can nurse over the baby so that your breasts are off your rib cage to help. You can also take an electric toothbrush and turn it on and use the bottom of it to help to get the clog and all that trapped milk out. You can use the pump, and you would do the normal, and then about 5 minutes after the normal setting you normally do, you can turn it back to the letdown phase to get another letdown out of there, or by doing a lot of compressions while you're pumping can definitely help get rid of that bleb. If you have like a silicone, I call them non-pumps, like Haka brand or any of the others, you can take it and fill it, put about a tablespoon to 2 tablespoons of Epsom salts in it, and then some very warm but not hot water, and put that on, and with that little bit of suction and Epsom salts, it can help loosen a clog too. A lot of moms also like the supplement soy or sunflower lecithin, and that can really help. It's an emulsifier, it's in ketchups and stuff, but it can help with people that have recurrent clogs. If you get a clog or mastitis in the same place twice, you need to seek medical help to see why it's happening. Is it positioning? Is it the baby? Is there a more dense portion of your breast? Maybe you need an ultrasound to rule out why. And like always, if you have any questions, you're welcome to ask them here or on our La Leche League of Central Kitsap Facebook page, or I'm Katie Dunning. You can text or call me and ask your questions. Thank you.